Jaime has been doing some pretty cool stuff with VoiceThread in her nursing classes. So Jaime, do you want to share? I'll turn it over to you.
Open on the VoiceThread portion first, just my whole, hold on, I'm trying to close this. There we go. Where it lists my VoiceThreads, because I'm having students do a couple of different things. I'll show you the one that I think at this point is probably the most popular one with students and even with other faculty that have taught the course. But to give you an idea, like the one that says burns over here and endocrine, those are ones that students have recently created in a new project that I tried. That's kind of an unfolding process where they are using VoiceThread to basically present or deliver some content, and then they're going to build an actual or create a patient based on that content. So the first part is that they create the VoiceThread with the core content. So, okay, so coming up for air is the most recent discussion that we've used. And you can see in this one,
hello, this is VoiceThread discussion 4 for Nursing 401. We are coming up for air, so we're going to talk about COPD, and hopefully you've already gone to Blackboard and read the 2 articles and looked at the short clip on COPD. We are going to discuss those now, and we're going to come up for air and have some questions and answers to discuss about
So I give them an intro, and then I gave them instructions on the next slide, which you can see. And this is just for one of our weekly discussions. We have about 7 throughout the semester. And then I did some open questions. They also, for this assignment, they actually read an article first and watched a video about a patient who's living with COPD. And then they had to talk about kind of what they've seen in practice. And I think what's important in this kind of discussion using VoiceThread is that I've learned that you really have to ask questions that don't have the same answer. So anything like what are the signs and symptoms of COPD would be, you'd get the same answer from everybody. So I tried to use some different questions to try to, I guess, elicit other thoughts about medical management. So alternative health is one of them. Why, in general, why do they think that people don't want to stop smoking even though they know the risks? Because that leads to COPD, and kind of what kind of impact. So that's what I did for this particular assignment.
Can I ask you a question, Jaime?
Sure.
Did you have the students comment on all the slides, or did they have the option to choose particular ones, or how did that work?
So for this discussion, I only had them comment, and it says in the instructions, I had them comment. They chose 2. So in some of the discussions I've done, I've asked them to comment on 3 or 4 slides. Everybody comment, and then on others, I've had them just like for this discussion, I decided I would let them pick. And so out of the 4 or 5, yeah, there's 5 total questions. They got to pick 2. And then as far as peer responses, I think there's a number of things you can do because, you know, in the text discussion, I think a lot of times we say we'll respond to 2 other peers because you want them to try to have some kind of discussion about it. For this assignment, I had them respond to 2 other peers in the slides that they didn't answer. So in an effort to still have them be involved in some of the other questions, I had them comment basically or do a peer response on the slides that they did not answer an individual response.
One more question. Mm-hmm. And are you actually tracking that and assessing those, or how does that work for you?
I am. I have a rubric that I modified from what we used to use for our text discussions. I'm not using gradebook because of that number issue. I don't want to have to revise because the discussions are only 10 points each, and if you put them in gradebook, then you're going to have to go back and figure out how to recalculate it in your totals for gradebook. So I just use my rubric and spend the time it takes, which is lengthy, and go through and listen to each of the responses and make sure each individual has done 2 peer responses, and it's not just like, that was a great posting. Something of some substance. And I have a rubric that I use for that, specific to what I'm looking for.
Then in turn give them that feedback?
I don't give them, I do and I don't. I give them points, and then I will write, like, you know how you can do quick comment in the gradebook?
Yeah, I don't use gradebook, but okay.
Okay, so in the gradebook, when you put the points in, you can do quick comment. And so I give them a quick comment on there. Most of the time for these discussions, students go over and above what my expectation is, I guess, in the discussion. So I've never had a problem. But yeah, the problem would be giving feedback all the time if you're doing a lot of discussions, giving video feedback. I will come in and comment just and do a general comment after they've posted myself without a grade, and try to add to the conversation or give comments or feedback about what they recorded. But it's really, I guess at the very beginning when we talk about these discussions, I explain to them that this is really discussion among peers and that it is evaluated for their contribution, but that most of that discussion is going to happen during the week, and then I will come in at the end. I don't have a lot of real-time like integration, if that makes sense.
Jamie, would you be willing to share your rubric?
Sure. Yeah.
I was thinking maybe I'll figure out a place for it on the wiki, but that's a pretty common question that I often hear from folks is, you know, how did you do the assessment, and can I see how you set it up, because it's, yeah, seeing those kinds of things can be really valuable.
Sure.
So that'd be great.
Yeah. And then just to give you an example of something totally different, this is the VoiceThread I was telling you.
Welcome to your last.
Probably the most popular among students and faculty so far, because for nursing students, it's just so different than what we normally do. So what I did was there was a peer, kind of a colleague of mine that was in my PhD program who did her research on visual thinking strategies. And she actually takes a combined group of health sciences majors, medicine, nursing, and they go to a art museum. And she has two people through the art museum, I guess, that facilitate the event, and they do visual thinking strategies. They use visual thinking strategies and ask them prompting questions about the art that they're looking at. And the goal, at least for these health majors, is really how do we assess, and practicing those assessment skills by looking at art. So because I didn't have a way to get our students to the art museum all the time, I decided to use VoiceThread, and it's been really successful, I think, so far. So different from my other VoiceThread, the instructions ask them to choose 2 slides to comment on, and again, there's about 7. But this time I don't want them to listen to peer responses. I want them to look at the slides, look at the art and the images, and then respond before they listen to anyone else's recordings. Whereas with the other discussions, usually they listen to the posted recordings already and then add to the discussion. So kind of a flipped version of what I usually do for our discussions. And then I gave them some prompting questions to think about and told them to spend about 5 to 10 minutes looking at each slide they decide to respond to. And so there's some abstract images and art. I used and added, thanks to Michelle's suggestion, added some photography. But I kept some art pieces in there that really, some of them may, like here you can question a lot, there's a lot of questions or student responses that talk about whether this is an ill child with a parent, and if this is medicine or what it is. So it's really interesting from the nursing perspective to see what they assess this as. This is actually my daughter a year ago when she was 5 playing on the iPad. But what's really interesting is the students think that this is someone who is in pain or agony or terror, just because of the colors and the image with her mouth open. I think they think it's someone yelling. So it's just really interesting to see what they come up with. This artist is known for having a lot of images. He was going through cancer and did a lot of art related to empathy and caring and trying to kind of bring across those feelings. So I kept one of his pieces in. This is actually a friend of mine who died of cancer, but I felt like it was really, it would invoke a sense of different feelings. And a lot of the interesting comments are, they try to assess what's going on in the room, what equipment is around the room, if there's pillows, what position the person is in, with the images different from the art. So we talk a lot about how this is applicable to walking in a room and what do you see and notice with assessing your patient, and how much of that are you already doing before you ever actually listen to lung sounds. So it's been a really fun activity. So those are the two I thought, and then at the end of this one, I actually asked them for some feedback on this assignment to see if it was worthwhile. So that's what
I love
got.
that. I love that activity, and of course, it's probably because I'm trained as an art historian. But I just think that kind of blend of the different disciplines is so powerful, and I also think it's very telling that you perceive this to be your student's favorite. Right? I mean, that really says something, and maybe it's because there's no wrong answer.
Yeah, I mean, and this is something that it's, basically credit, no credit. There isn't a rubric. There's not, this is you contribute. And then I do have them comment. I do have them go back and listen to other comments, because there is a diversity of perception, and some, especially with the abstract images, what they see or perceive.
I'm just reflecting on how important that is to have students engage and reflect and think critically without that pressure of finding, the right or a right answer. Because, I know that from my experiences, and maybe if some of you agree or disagree, but when I set up things where, I just kind of expect my students to just jump in, and they almost kind of don't know what to do, right? Because they've been so in this, like, what do you mean? I mean, education trains you to look for the right answer. And so I find that really refreshing about that activity.
Well, and I try to tell them that in the beginning, because I want them to feel comfortable just enjoying it and really looking at the images and spending some time just thinking about what they think of the colors, how they feel about it, what is their first impressions, kind of thing.
And it's helpful that it's later in the class, so they don't have this kind of tool anxiety, right? Like, where do I click? And they're already kind of comfortable with the VoiceThread environment, which I think is a great strategy to integrate it at the end.
Yeah, it's our last discussion usually for the semester. So
we should do this in high school in the class. The teacher that Stacy and I met, she used to do this. And met through.
There's a lot of visual thinking strategies use in K through 12.
Yeah, but I've tried this over the years and haven't really used it all that much, because in the classroom, it's a very I don't know how they did it in the museum, but it's a subjective thing. And so, what do you see about? Usually, it would be a complex image that had, once you start staring at it, you see more and more things. And the idea was to, can you look more and explore more? But it seems like once a couple students say something, the others feel, oh, I don't have maybe as insightful an answer. And it might be interesting to try this on VoiceThread, where everybody was time shifted and everybody. So
and if they really follow the instructions and really don't listen to anyone else's first, they don't get tainted, right? Like you're talking about. So I think that would be good. It was really interesting, because my friend Meg Mormon, who did her research on visual thinking strategies, and I guess at the art museum there was this, I don't know, like mannequin or paper mache person, and it was a male and a female, and the print was all Barbie print, and like Ken and Barbie print. And so all the students, I guess, were talking about, that it's talking about the idealistic version of the male and female with the Ken and Barbie print. And an international student said, who's Ken and Barbie? So it was really, impacting in that way, even where, their background didn't set them up for knowing who Ken and Barbie are. So their perception of that had nothing to do with the perfect male and female body, so.
Have you tried any voice? So you're doing like VoiceThread, and then, do your thing, and then after you've done your thing, listen to other folks' contribution? Have you tried it where you just don't let them listen to anybody else's, and you first just have people only comment, and then say the next week or something later, then have them go back in and comment on other people's things? Just
on this activity, not in the other types of discussions we've done, primarily because the other types of discussions, it's helpful, I think, for them to add to the discussion, because we talk about like healthcare costs, and have you ever had any problems or experiences with insurance and issues with medical care and access to care and things like that, where they can keep building on that discussion. But for this activity, that's what we do, is they post their response and then come back and read and listen to everyone else's and respond.
And I think what you're saying, I mean, the student's default is not to incorporate other comments. It's easier for them not to sometimes. And so for me, at least for the first year students, I have to kind of force them into listening and responding. So their default would probably be not to listen to anyone and just say what they want to say. And then you hear the same thing 20 times.
Well, and that's why and that happened to me the first time I used VoiceThread, is I asked these questions that I realized really have a repetitive answer, just a little slightly different. So I had to really think about, what do I really want to get out of this, and what questions do I really want to ask, because I don't think it's something where you can just ask knowledge-based questions.
And even if it's a more interpretive question, if sometimes they just listen to one or two and kind of just then say the same, they just repeat what someone else has said.
Yeah.
So one of the things that I do in my ground rules for my students' voice threads is one of the criteria is that their comment has to be original. So they are expected to listen to the comments on the slide first and make an original contribution. And I say it's fine to build off someone else's comment. If you want to reference the name of another student and say, for example, Stacy shared this and that reminded me of this, then that's still original because you're building off of it. But that's one of the criteria for the grading in my class. So that's something to consider that might help a bit.
Well, and I think doing where you have, if you have a large class, really, you have to have ways to deal with that. I guess the other option would be to have the multiple slides to comment on. So that even if you do have similar comments, depending on the number of students, you break it up a little. Once there's or limit how many can comment on each slide.
Yeah, and like you said, have 10 slides, or I know that gets hard to make that many sometimes, but have 6 slides and have them comment on 2 or something like that. So that way there's some spreading out across the entire activity that can help. Yeah.
So that's what I got.
Thanks for sharing, Jaime. That was really, really helpful. It's good to see what other people are doing.